My name's Charles Bishop. I'm a licensed acupuncturist with Artemisia Acupuncture, which is just a small private practice. It's just me right now. I practiced for 3 years in the Twin Cities, and then I've practiced for about 3 years up here. A little more than 3 years, actually, 4 years in the Twin Cities. And I tend to practice a few different kinds of acupuncture, but we're going to kind of go through that when we talk about, East Asian medicine as a whole. We're pretty small, intimate group, and I'm, not super versed in leading Zoom settings, Zoom classes. But Adria, if you see anyone with a hand raised that has questions as we go along, because we're going to try to cover a fair amount of material, as you'll see pretty quickly. And I don't want to get bogged down in anything too much, but also if there are questions, I'd rather kind of attack them right away rather than wait for them to, be lost or forgotten. And yeah, without any further, go ahead.
So people can either, do you want them to raise their hand or type them in the chat? What would you prefer, Charles?
Whatever works for you. I won't be monitoring the chat, and I
will certainly do that for you. Yep.
Okay.
So I will monitor chat. So
and
if anybody wants to put
I'm happy
your
for you
questions.
to read out the questions or for people to say them themselves, whatever works best.
Perfect. We'll do that. So if you want to read or put your questions in chat, and I will read them out loud. That way you can remain anonymous as well. Okay. All right.
All right. So I'm going to try to share my, go ahead. Hold on. You're still muted.
There, I know, I'm muted. I'm just looking here. I've done Zooms before, but I have never done the chat. Where am I looking for that if I have to do chat?
Yep. So down on the bottom of your screen, there should be a few options there, and there's a button that says chat. So if you click on that.
Okay, yeah, I have to hit the screen first. Okay, got it. Thanks.
Yep. Okay.
All right. So I think I'm just going to share my screen and we'll get going. But yeah, feel free to stop me anytime if you have any questions. All right. Let's see here. This will take me just 1 second. All right. Can you guys see that? So I'm calling this class Introduction to East Asian Medical Theory. So this is a theory class. It's not a lot about application. I previously did an application class about pressure points for neck pain relief that a couple of you guys were at. This is all just about the basic theories of how we look at the body, how we look at our interaction with nature, why diseases come up, all of that. And hopefully this will be at least a little bit illuminating, if not also maybe a little bit confusing, because the first year of East Asian medical school, everyone's confused at least a little bit most of the time. But I'm happy to answer any questions to the best of my ability. So here we go. So the first thing I want to address is, this might be an unfamiliar name. A lot of people call it Chinese medicine or TCM, traditional Chinese medicine, or even Oriental medicine. I really like the name traditional East Asian medicine because it doesn't have as much baggage as the rest of these. Traditional Chinese medicine is actually kind of a specific style of East Asian medicine, not just from China, but from China in the last 60 years after the Cultural Revolution. So it kind of puts aside some aspects of the medicine that a lot of us really find useful. I used to say I practice traditional Chinese medicine, or TCM, and actually my degree is in acupuncture and Oriental medicine, one of the only places you still hear the word Oriental spoken. So I think there's kind of a lot of baggage with a lot of these terms, and I feel like traditional East Asian medicine is really inclusive and really respectful. Another aspect is that in the last 2 years, I've really shifted over to practicing a style of acupuncture that is Korean in origin. I mean, a lot of the theory and the original application definitely still comes from China, but the development of this style was definitely Korean. So I like to be very inclusive because I no longer practice a medicine that's exclusively Chinese. And then it just makes great acronyms. So rather than saying TCM, I like saying team because, anytime I work with someone, it really is a team effort. It's a team effort on changes they're making, on observations we're both finding, and just really working together to find what works best for any person. or you can have more fun with it and call it tea medicine, which is just kind of fun. But for this presentation, we're going to stick, I think, with team and kind of keep it right there. So anytime you see the word team in capital letters, I mean traditional East Asian medicine. And most of the time, I'll probably just say it outright to not be confusing. That being said, if you've heard about traditional Chinese medicine, acupuncture, we're talking about that. So it's essentially the same thing. I just want to be broad and inclusive with it all. All right. So what is traditional East Asian medicine? A lot of people will say, oh, I go to an acupuncturist. So there's acupuncture. And that's very much a big part of it, but that's a tool and a system within the broader scope of traditional East Asian medicine. Or maybe you went to an herbalist or an acupuncturist that was also prescribing herbs. Again, huge amount of information there and similar but slightly different theories surrounding the application of herbs as opposed to acupuncture in terms of what you're looking at for diagnosis. But these are two definitely big aspects of the medicine. Moxibustion, so heating of substances, usually mugwort or a mugwort mixture on the body for some sort of heating therapy. I used to do a little bit more of this. I don't now, just mostly for ventilation issues. I work in a small space that in the winter is really cold. So I don't want it to get too smoky for everyone. Cupping, a lot of people have heard about cupping or fire cupping. I do use a lot of this. Tuina or medical massage. So this is a little bit similar to Thai massage in range of motion exercises, spreading joints, really trying to get energy flow through the body, but through massage rather than needles. A little bit different than acupressure. You could say acupressure is a type of tuina, but it's the way acupressure is practiced, it's not a full scope and a full system like the massage called tuina is, which means tuina means grasping and pulling. Qigong, so energy work. This can be energy work by the practitioner directly onto the patient. It can be energy work that the practitioner teaches the patient, meditations, even visualizations while they're having acupuncture or moxibustion or what have you. Really big part of the medicine that's often overlooked. And of course, dietary therapy. Not every acupuncturist. Go ahead.
I'm going to interrupt you real quick. I'm not seeing any other slides other than the intro slide. Are we supposed to be seeing a different slide?
You're only seeing the intro slide.
Yeah.
That is distressing. Okay.
They're all on my they're all on the edge.
They're all on the edge.
Are you in the presentation view?
Yes. So you guys can't see when I switch views.
No.
Oh no. Hold on.
It worked when we tested it before we
It worked when we tested it. So let's
Oh, now I can see what is team. Yeah.
Right. So let's try this. I'm going to stop my share and try it again.
Okay. I should have chimed in sooner.
Let me try something different. Hold on. Okay, I think we can do it this time. Thank you for telling me.
Sorry, I didn't see anything.
Seeing all this stuff that no one else has seen. Okay, let's try this. Okay, so you saw this screen.
Yes.
And now is it switching?
Yes.
Okay.
Yes. Yep, we see
so
that.
I went through all of this, but I was just going through kind of bullet points. Inclusive and respectful, great acronyms. All right. So just what I was trying to say essentially with this is we often think of traditional East Asian medicine as its tools, as acupuncture, herbal medicine, moxibustion, the heating of mugwort or other substances on the body or close to the body, fire cupping, Chinese medical massage called tuina. And again, I'm going through this quickly because we just went through it. Qigong or energy work, visualizations, meditation can all be kind of under the big umbrella of Qigong, and dietary therapy. So all of these are really interesting, really essential aspects of the medicine, but they aren't the medicine itself. These are the tools of the medicine. And so these incorporate the theories of the medicine, but they're not actually the medicine as a whole by any means, each a small part of it and an important part. So now my blood's racing because everything wasn't working, but now it's working again. But now I'm all excited because this is really a very interesting medicine because it looks at humans and the environment and how we all relate. So it's a systems medicine. And I want to actually just read this out because normally I don't like that with PowerPoints, but it's a mouthful. So traditional East Asian medicine is a dynamic, nonlinear systems theory medicine based on our interaction with nature and the balance of motive forces and physical substances in our bodies. So yeah, big mouthful. What does that mean? So one of the things that's really hard when you first start studying this medicine or looking into it is that everything is relative and everything references something else. So you have to kind of understand the full circle a little bit before you can understand the parts of it. Normally we want to understand all the parts and then sync them together to see the big picture. So it's almost like rather than, drawing a piece of a picture really well and then drawing another piece and then drawing another piece to eventually get the whole scope of a picture. When studying this medicine, it's like looking at a picture through a very blurry glass pane, and slowly as you see all the parts, it starts coming into focus. So this medicine evaluates the flux of manifestation, like what we see from a patient, what we see in ourselves, what we see from nature, rather than searching for a material cause of illness. So we don't use germ theory. We're not looking for germs. Even though we might talk about causes of illness, we're not looking for a substance or a thing or an idea or a physical thing that we can lock onto and say, this caused this, and look at it in a linear fashion. It's not like mathematics where we can take things step by step. You have to look at different levels all at the same time and see how they interact. So that can be the confusing aspect, but it also makes it really adaptable. And once you get comfortable with it, you're not always going to know what's going on at any moment or always be right, but you can adjust your thinking and adjust your treatment or adjust your understanding even of a system to figure out of an illness or of a pattern to figure out what's going on. And so you always have kind of slightly different lenses you can look through to figure out anything that might be confusing. So what's the worldview of traditional East Asian medicine, or what's kind of the basis of how it looks at the world? I think pretty obviously it's nature-based. We use a lot of nature-based language or jargon. This is because it's, best estimates are about a 3,500-year-old medicine. So as it's being developed, people are using the language of their natural surroundings to describe things. So we talk about yin and yang, which of course we're going to get into. We talk about 5 elements of earth, metal, water, fire, and wood. We talk about causes of disease. Sometimes, I know I said we didn't talk about causes, but we talk about them as patterns. So patterns of wind, of dampness, of heat, of fire, of dryness, of coldness. So one of the reasons it's important to point out this nature-based aspect is that it can also make it seem really hokey. Like, what do you mean I went outside and wind got in my neck and now my neck hurts? Like it can make it seem really new agey in a way that is easy to dismiss, but it's also just the language that it was developed with. And if we keep that language, we can utilize it to kind of a more full capacity than if we try to adapt the language to maybe a more rational or scientific basis. It doesn't mean it's not, scientific or at least quasi-scientific. It just means that the language is very nature-based. It looks a lot at cyclical movements of energy. So we're looking at the way energy moves in the body throughout the day, the diurnal cycle. We're looking at, day and night cycles. We're looking at seasonal cycles, even often looking at moon cycles. Not always with nature. We're looking at yin and yang as a cycle. They're constantly changing and evolving into each other and shifting their their dominance in the body, and ways to balance that. So it's kind of like a wheel on a bicycle when it comes in treatment and diagnosis. When it comes out of true, we're trying to figure out where else on the wheel can we adjust it so that it brings it back into a perfect circle. And we're going to talk a lot about movements of energy, movements of blood, movements of yin and yang. It talks a lot about interconnectedness and resonance. So in some ways, we talk about how we and nature affect each other, but really, as we're knowing more and more through climate change and through quantum physics and through just physics and harder sciences, we're all interconnected. We're interconnected with our environment. You can't take that out. You can't take out the observer from the experiment. We see a lot of interconnectedness. So a lot of it is also, the practitioners trying to cultivate and keep themselves healthy so that when our energy and our presence interacts with someone else, especially in our clinic and through therapy, we're helping them, and we're not trying to take on their baggage and they're not trying to take on ours, but there's always some intermingling a little bit. And resonance, we're going to come back to a lot later too with diagnosis. But we see things, like I was mentioning, on different levels. So we're going to see very big macro levels and cyclical levels that are kind of, day-to-day levels, and very micro levels, but they all represent each other. So for example, often I look at someone's ear as kind of a map of their whole body, and I can see some manifestations come up on their ear, or I'll touch their pulse on their wrist, or I will look at their tongue, because these are all in a sense maps or microsystems for the whole body. And similarly, with nature and the seasons and everything affecting us. Before we got on, Adrian and I were talking about our favorite seasons and how we feel good and bad in certain seasons, because we're really affected by them. And there's some idea that if we cultivate and heal ourselves, we also kind of heal the environment around us. So there's a lot of resonance discussion in traditional East Asian medicine. And then, of course, there's adaptation. And I bring this up because the difficulty with a new systems-based view of the world, like I'm assuming this is somewhat new for a lot of you, is that you kind of, as I was saying, you kind of have to see the whole picture before you can look at the parts, and that makes it a little bit difficult to jump into. But it's nice because it's a very adaptable view. You can look at different parts as different lenses that you can look through and see, changes or cycles that you can adapt your thinking if you need to. And also the idea is that even in illness, that's an adaptation, that our bodies are choosing kind of the lesser of two evils. Often when I work with really chronic conditions, there's some aspect of something came up a long time ago. It could have been an injury, it could have been an illness, it could have been just really, really strong emotions through some sort of interpersonal relationship or some loss that lodges in the body. And so we're trying to figure out how to kind of unwind that. And always it's an uncomfortable issue or pattern, but it's showing that the body is adaptable, and it's saying, let's create this manifestation, let's create this this issue that's localized and we can deal with, or we can keep latent, as opposed to letting this really strong emotion and the chaotic energy of it like circle through our body over and over and over. And sometimes it does happen. So we're not always perfectly adaptable, but there is a lot of adaptation in the medicine, and it's looking at how is someone adapting and how can we help them adapt, beyond the situation, not just be stuck there. All right. So lastly, a couple of quick caveats, just some things I kind of mentioned, but I want to get back into. I did not mention this. We're going to talk a lot about organs and organ systems. And so they have a lot of the same, they are essentially the same name. So like the heart organ, the liver organ, the kidneys, there is a lot of crossover with anatomical organs, like your physical kidneys that filter your urine, or your heart that's pumping your blood, but it's not exactly the same. So for example, I'll see someone who's not sleeping very well because I diagnose them as having a heart yin deficiency. they might have a rapid heartbeat, or they might feel a sense of discomfort in their chest. It does not necessarily at all mean that they have heart issues, like physical heart issues or heart disease, or that they need to see their doctor or get, echocardiogram. And I just mentioned this to say they're very similar, but they're separate. So try to create that space when we're looking at this, that as we're talking about organs and organ systems, which I'm kind of using those two things interchangeably within traditional East Asian medicine, you can compare them to the anatomical organ, but don't think they're the same, because they have we have different views on them a little bit, as you'll see, pretty straightforward. Similarly, diseases versus patterns of disharmony. Often East Asian medicine can really help someone with high blood pressure, but we don't treat high blood pressure. We don't look at someone and say, oh, you have high blood pressure, let's treat it like this. There are, of course, acupuncturists that might do it that way. It tends not to work the best, because you see the disease as a type of pattern, but it can be a whole bunch of different patterns. Someone could be really, really dry, and so their vasculature is kind of desiccated, and that could bring up their blood pressure. Or they could be really, really hot and angry, and they can have a lot of high blood pressure from that. And so we have to look at not what is the disease, but what are the manifestations? What's that flux that we're looking at? What's presenting? And maybe, we can look deeper than that at the root and see the pattern of disharmony and treat that. Treat what we see, not what a disease name is. Like, we don't really have disease names, because it's all about, we name the manifestations essentially, as opposed to a disease, which can be kind of nitpicky, but it does matter. And then clinical experience informs theory, which provides a framework for clinicians. This is obvious, but a lot of this theory seems kind of out there. But the reason it's there is because it works, and because we can utilize it, and we can utilize different levels of it. We can utilize just yin yang theory, or just 5-element theory, or just organ theory, and do really well. And if we're not doing well, we can step out of one of those and go to a different one to see, what we might be missing by looking at a specific level of the theory, even though they're all interrelated. And then I mentioned this before, but everything is relative in traditional East Asian medicine theory. So we'll talk about yin and yang, which is the kind of the basis of the relativity, but we're always looking at what are you talking about or looking at and thinking about in relation to what? Like, what is your viewpoint that you're coming at it from? So a good example is we're going to talk about blood as a concept and as a thing, a thing in the body. I talk a lot about blood being warming and blood being cooling, depending, because it's very moderating. So its use and why we're kind of working on a blood level is relative to the person and the manifestations. So we're going to talk about yin and yang, but we say, is blood yin or is blood yang? And it says, well, relative to what? Relative to qi, it's very yin. Relative to something deeper like Jin or Ying, it's very yang. So we'll get back to that, but just something to keep in mind. Everything's relative, and so there is going to be a lot of flux in what we talk about. All right, so now we can get into the big stuff. As far as a root or an axiom of the medicine, yin and yang is kind of as deep as it goes. Like that, it's very much the basis. A lot of people have some kind of grasp or concept on this, but it's really worth talking about for a minute. So we've all seen this. The whole yin and yang symbol in this scenario is called the Taiji, and it's yin and yang moving around each other. And the dot in yin, the black, is white, and the dot in yang, white, is black, because they each hold a seed of each other. And so we're going to talk about the 4 principles of yin and yang as the basis. Before we get to that, just quick primer. Yin and yang are opposites. So we kind of talk about a lot of dualities to kind of get the idea of the concept of yin and yang, because it's primarily a concept, although we will talk about them a little bit as substances. even though it's not a substance that you can, isolate and point to and say, this is what yin is and this is what yang is. It's more functions in the body that we can isolate our thinking about. So anyways, yin is night, yang is day, yin is dark, yang is light, yin is cold, yang is warm. I like to think of them not as negative and positive, but more as substantive and active. So without yin, yang has no place to go. It has no body, has nothing to manifest in. And without yang, yin is inert. It is just substance. It has no change, no motion. It can't generate or grow. So we're going to talk about them as being inseparable. So here are the 4 principles. Yin and yang oppose each other. So they're opposite, as we were talking about. And they keep each other in check. So yin and yang both, at some level, brace each other and consume each other. So it's a constant flux, and they're never perfectly in opposition, but one's always a little bit more dominant in a person or in any scenario that we look at. But they oppose each other, and they also, they're interdependent. They also define each other. So you can't have yin without yang, both in terms of just the concept, like any opposites, they kind of define each other, but also they need each other to manifest. So there's nothing we can look at and say that's pure yang, and nothing we can look at and say that's pure yin, even though we talk about them sometimes as singular pure substances. Or there's, we're not going to really talk about it today, but there's 2 meridians in the body, the ren and the du, or the conception and the governing vessels, that are the pure yin meridian and the pure yang meridian. But it's never pure. They're always in some state of flux and interdependence. So they also mutually support and consume each other. So this is interesting. It sounds a little bit different than what we just mentioned, but yin actually, even though it's opposite of yang, actually will generate yang because they're interdependent. That's that seed that you see in the yin yang, the taiji symbol. So a good example of this is eating food. Like, we need energy to yang as energy. We need energy to gather food, to grow food, to whatever have you, procure food, to cook food. And then we need it to eat and digest food. Like, we need that action and the energy to get the food in us and to break it down. And then it essentially is yin in our body, more or less, if it's a pure yin food. So we've used up yang to get that yin, but then that yin will start building energy in our body. First it builds substance, and then it builds energy in our body. And so that yin that we've broken down is becoming yang again. So it is this kind of cycle of interdependence and, in some sense, consuming each other. Like, you're kind of always using up yin to manifest yang, and then using up energy in yang to build and generate yin, which will become kind of more apparent later. And then kind of what I was just mentioning, yin and yang transform into each other, but this is also a example that we look at extremes. So in extreme scenarios, if someone is really cold and they can't move and they're sedentary, there might be a fever or heat that builds in their body and manifests. So someone that has an extreme yin condition can suddenly manifest a lot of yang energy, and it's, in those cases, these extremes are never good. So we try to keep everything out of these extremes and in kind of a harmonious relationship, because as soon as you go all the way to one side, it's essentially trying to create something that can't exist on its own. And so it will naturally manifest, not necessarily as strong, but an extreme version of its opposite to try to get back into that balance. And we often see this with really, really severe diseases, or sometimes close to death. And when I say we, I mean often ancient doctors, because a lot of these, I'll never see this in my clinic, because, and if I do, I'm sending them to the emergency room because I want them to get emergency medicine right away. All right. I think that's it for yin and yang right now. We're going to keep visiting yin and yang, but that's, very simple, but so basic that we need to kind of have that under wraps. So now we can talk about things that are a little more tangible, even though it's not necessarily these substances in the body, not necessarily something we can isolate. So starting with yin and yang, we see our accumulation of yin and yang, our reserves, as something called essence or jing. So this is the material basis of our health and longevity. There's some correlation to fertility. So often we'll think of as like semen as a form of essence, or even menstrual blood as like kind of a form of essence that we shed. But what essence essentially is this deep, extremely concentrated reserves that we can tap into. So it does have some connection, some parallel to like our adrenal glands, or to even our you could say the health of our nervous system in some ways. So we see that decline through aging. But again, this isn't something that we can isolate in the body and say, here's your jing, we found it, we have a bag of it, it's this much. It's really a concept, but we can evaluate its amount and function through manifestations, through pulse, not as much through tongue, but through looking at someone's face, looking at someone's eyes, looking at someone's ears, and then just the quality of how they age and bounce back from illness. Blood seems like a very simple concept, and it mostly is similar to anatomical blood. It is the nutritive and hydrating substance in the body. There's another hydrating substance we'll talk about in a second, but the reason, so this can seem very much like a thing we can grab onto, and in some ways it is. It's a little bit different in its concept than anatomical blood, but we essentially break it into similar parts, like nutritive aspects. We break into a protective aspect that we talk about, and we can talk about different parts of the blood as being, good or depleted. We sometimes talk about there being too much blood, but that's pretty rare. Usually we use up our blood and get kind of blood deficient, and we might have poor sleep or pallor or poor memory or poor concentration, and we don't have this substance to kind of rely on and nourish all the parts of our body. So this is a day-to-day nourishment. Body fluids, pretty straightforward, the hydrating substance in the body, but this also includes cerebral spinal fluid, synovial fluid. So it's a kind of a broad term. So if somebody's really dry, we might, they have dry skin, dry eyes, dry mouth, we might work on a blood level to hydrate them if needed, or we might work on a body fluid level depending on the manifestation and where the dryness is and how pervasive it is. Energy or qi. So we talk a lot about energy in East Asian medicine, and essentially it's the potential to do work. So all the processes in your body require energy. Energy is keeping us alive. It's present while we sleep. We talk about cycles of energy in the body. It's a pretty straightforward concept, but again, it's not, electricity in the nervous system. It's not our cognition. It's not any one thing. It has a lot of different manifestations and a lot of different flavors depending on what you're talking about. But essentially, it's all qi. It's all energy. And then mind or shen. So you can think of this as kind of the light coming off of a candle, or the field around us when everything else is relatively healthy. Everything, our qi is moving, we have enough of it, we have some energy, we're hydrated, our blood is nourishing, our organs are feeling good. We are not dead because we still have some essence or jing left. Shen or mind is kind of like what radiates off of us, or our ability to be a conscious person in society, essentially. So when you talk to someone and it seems like there's a big veil between you, and you feel really happy and healthy and with it, and there's something about this other person that you're not quite sure, what was going on. It could be that they have, something going on with their shen where it's not really vibrant. There's something fuzzy about it that's preventing it from shining. So we look at shen a lot as radiance on the face or as a vibrancy in the pulse. And we evaluate it to figure out kind of what's going on in the body. All right, any questions? Everyone doing okay? Okay. All right, so now we get to talk more about specifics. Just checking the time, see where we're at. Okay, good, doing well. So again, talking about organ systems, I often just refer to them as organs, but it's an organ system. So the heart system has a lot of similarities to the heart organ and the pumping of blood around the body, but we also talk about it as the aggregate of Shen. That's where our mind consciousness is. Of course, it relies on our brain, but somebody in this medicine with a disturbed heart or something issue going on there, it's really easy for it to manifest as issues with cognition, issues with sleep, issues with their presentation and interaction with others. And so again, they're similar to the anatomical organs, but they definitely have their own flavor and wide nuances that we have to look at. So there's yin organs, and so we call the organs the zangfu. The yin organs, or the zang, store those vital substances we just talked about and govern their distribution. So the kidney, the liver, the spleen pancreas, it kind of has more analogies to the pancreas than the spleen, but traditionally we tend to call it the spleen. The lungs, the heart, and the pericardium to some extent. So these are all yin organs. They store different substances or have different relationships with different substances. And as we talk about meridians or channels, they spread these throughout the body. So the kidney, we call that your deep well of energy. That's storing your jing or your essence. So if someone has really poor kidney qi or poor kidney jing, they might be aging really fast, or they might not be recovering from illness very well, or just have, maybe they can get through day to day, but they have no reserves. We talk about the liver storing the blood. Very often in my clinic, if I'm treating someone with blood deficiency or there's an issue where I really want to boost the nutritive aspect of their blood, I'll focus on the liver. Not always. Sometimes we'll focus on the digestion to kind of get things processed. But very often we're boosting that liver meridian to try to boost the blood. The spleen pancreas, I don't want to get too deep into this because it gets kind of weedy, but it essentially is involved with the body fluids. It has a lot to do with the digestion, definitely, but you can think of the amount someone is dry or the amount someone is damp has a lot to do with the spleen in terms of East Asian medicine. The lungs govern the qi. They're the bellows moving everything in and out. They're kind of creating that pressure to circulate the energy. When we do Tai Chi or Qigong or even yoga, we're often using breath to push energy to different parts of our body or to do visualizations. The heart, we talk about it, as holding that Shen and really being the epicenter of that. We're not going to get into the different parts of the ideas of, different spirits or different Shen in the body, but the heart's the aggregate. So the heart makes sure we talk about it as the emperor. It's making sure everything else is playing well together, and it has kind of a governing aspect to it. I don't really want to talk about the pericardium outside of the heart. They have a lot of similarities in the way I practice. Oh, excuse me. I went back somehow. In the way I practice, often the heart has a very outward motion and the pericardium has a very inward motion. But essentially, the heart is so important, as of course we all know, that in this medicine, the pericardium, you can think of it as the heart protector. It is aiding the heart and venting extra heat, in getting enough blood, in internalizing new lessons, new things that will help us adapt to our environment or to our social situations. So the pericardium is like the most trusted friend or advisor, and we can use it often to really help the heart without having to interfere with the heart, that kind of most important organ, directly. Although sometimes we will really boost the heart or shift something with the heart meridian to help someone with whatever they're dealing with. And so all of these organs have their own substance that they primarily deal with, but they all in some ways deal with all of the substances to some level. So like the lungs really need a lot of body fluids. They want to stay kind of hydrated and wet. The heart, of course, needs lots of good fresh blood going through it. So there's a big relationship between the heart and the liver. The kidneys, of course, process a lot of fluids in our body. So we look at a lot of body fluids with the kidneys. But these are storing and distributing substances to make sure that, and essentially yin substances. So essentially everything is in the body can be hydrated and nourished and relaxed and do their own functions, whatever that might be. So then the yang organs, which I meant to write fu, but they're the fu, essentially digest and process. So it's the urinary bladder, gallbladder, stomach, large intestine, small intestine, and then something we'll touch on just a little bit, the triple warmer or sanjiao, which means kind of like the three spaces. So, oh, I don't know why it does this. Something's going on when I touch my trackpad. So essentially these are helping us take in food, process food, digest it. If there are unmetabolized substances in the body, so something we might call dampness or phlegm, or even sometimes stuck blood, these help us process it. So they can get things from inside of us, outside of us, and they can help process our food and get the good stuff out of it, or process our water. So even the urinary bladder, we talk about that as having an aspect of steaming liquids around our body. So at some level, liquids get into us, they go to the bladder, and this is a very different concept, but in East Asian medicine, again, the bladder being a whole system that encompasses more than just the physical organ, we're talking about that yang qi coming up and steaming fluids around our body so that they can get everywhere. You know, they can get all the way up to the lungs, they can get out to the periphery, out to the skin, and not just holding liquid and excreting it. Each of these have a very discrete function, and they're also, all of the yin organs are paired with yang organs in terms of kind of governance and function, as we'll see in a second. And some of these pairs will make a ton of sense, and some of them, you know, are very new. I guess really quickly, the triple warmer, the triple heater, the triple energizer, the sanjiao, essentially is the three spaces in our body. So the cavity of the upper jiao being the heart and lungs area, the middle jiao being the stomach, the spleen, and sometimes the liver, depending who you're asking, and the lower jiao being the kidneys, the intestines, the urinary bladder. So it's the space that holds all the organs. And essentially, the triple warmer is a thoroughfare. So it's how things get places internally within our organs. And it has a lot to do with heating and cooling, and a lot to do with hydration, essentially. And when we talk about that jing or that essence in the kidney, constantly, even a little bit, you know, we're all pulling little bits from that jing and that essence, and turning that into different kinds of qi, turning that into blood. It's essentially a bank account that we can pull from that can be any substance we need to a little bit, almost like a stem cell. And the triple warmer or the sanjiao is how it's getting to places. So sometimes we're looking at an issue with a substance that there's not enough of in the body, and sometimes we're looking at just a transport issue. So we might look at the sanjiao for that. So yin organs are paired with yang organs. And this is, again, that kind of yin-yang relationship. And what's interesting is in health, we see them really helping each other out. And in disease or illness, we see them kind of playing rough with each other, let's say. And so we're always kind of trying to get them back into the right relationship and seeing what relationships are out of balance. So the kidney and the urinary bladder are water. We're going to talk a little tiny bit about elements, but we're going to really brush past the elements because that's a whole different topic that we can get into, even though it illuminates a lot of what we're talking about today. It's too much for today, but I do want to mention it because it's important. The liver and the gallbladder together are wood. And so kidney and urinary bladder, obvious pair. We see that pair in anatomical and Western medicine. Liver and the gallbladder nestled right together, have a lot with bile production anatomically, but have a lot to do with this wood element, which we'll talk about in a second. Spleen and pancreas, and as one item, and the stomach are earth, very much basis of your digestion. Kind of everything enters right in there, like, comes through the mouth, hits the stomach, and the spleen, pancreas, and stomach all work together to initiate that digestion. The lungs and the large intestine, a little harder to understand that pair initially, but essentially you can think of both of them are processing and helping us release. So the lungs process and release carbon dioxide. They make sure we get enough oxygen. They're separating what we need by what we don't need. They're letting, the gases we don't need out, and keeping, we call it, the good chi and the bad chi, but they're keeping the good chi in and bringing it in, and then letting what is stale or bad out. And then the large intestine, similarly, the very end of our digestion, pulling that last bit of water, that last bit of nutrition in, and then jettisoning what we don't need, what we can't use. And so they have a lot to do with separation and release. And then the heart and small intestine fire. So there's a lot to do with blood, with the heart and the small intestine together, for sure. And there's a lot to do with fluid and blood metabolism, in terms of the heart as a pump and the small intestine as an osmotic pressure throughout the body, trying to get it through. So in a lot of forms of East Asian medicine, especially like TCM or traditional Chinese medicine, you don't see a lot of emphasis on the small intestine. I actually, in terms of my theory and how I use it, I use the small intestine all the time in my clinic to kind of really push blood around the body as like an osmotic pressure, getting it where it's not, and especially helping with new and old injury, for sure, like physical injury where you might have pain or stasis. So we're going to really quickly touch on the 5 elements. And I want to mention 2 things about them that will be good food for thought, but we're not going to stay on them very much. Oh, sorry. And then the pericardium and the sanjiao, they're also fire. There's considered like ministerial fire and sort of celestial fire. So they have different aspects of their fire, but you can think of the pericardium and the sanjiao as awareness and attention. I know I said that a lot with the heart, but the pericardium, especially in the way that I practice this Korean style, helps us look inwards, helps us go to sleep, helps us meditate, helps us read and kind of look at our interior landscape. And the sanjiao is very outward. It's outward attention. It's attention to detail, and it's focused awareness outside of ourselves. So it's even beating ourselves up when we make mistakes in front of other people. It's being hard on ourselves. So don't want to get too stuck in that, but those are the kind of the weird organs we don't talk about as much in, and definitely not the sanjiao in Western medicine. So I just wanted to bring them in. So here's a chart of the 5 elements, or the wuxing, and it's translated as elements. And originally it was like physical elements, but we often talk about them now as the 5 movements or the 5 phases. And this is a big circle that we're looking at all the time in terms of sequential movements and counteracting movements. So if you look counterclockwise around the circle, it's a generating cycle. So wood, burns and makes fire. Fire dies down, leaves behind ash as earth. Earth generates metal as ore inside of it. And then metal, it's harder to see, generates water, but you can think of like your car or a cold glass outside, or with a cold beverage in it, it's sweating water because it's condensing air or water out of the air. But so it can look like metal is, spilling water out of it. Or you might look at veins of metal in the earth having, what's the word I'm looking for, springs near them. Again, kind of a concept we don't need to look too deep into, because we're really looking at the meaning behind it, not the actuality in nature. And is it real or is it not real? Because at some level, this is a functional medicine. It doesn't matter if things are real; it matters if they work. And so metal generates water, and then water hydrates the wood, the plants, and wood grows. What's really interesting about this, and then so there's a star in the center. These are counteracting things. So we think about wood gripping the earth and like digging into the earth, so it counteracts wood. Wood holds up water. Water always wants to go to the lowest place, so it counteracts water's natural downward movement. Water obviously puts out fire, and fire can melt metal, and metal can chop down or shape wood, just as an image. But what's really important as a basis with these, and we're talking about the organs and we'll talk about the meridians in a second as elemental, is that they have movement directions. So wood is up and out. So that gallbladder energy is very out. It's decisive, it's explosive, but then the metal element being lungs is very much more an inward motion, and they have more that it's less about your with the lungs and the metal element, it's less about your attention and more about bringing in chi, bringing in sustenance, bringing in fluids. And so we look a lot at these aspects. So wood is the springtime also, so it's that upward outward motion of spring, and often a lot of people can feel that in spring. Fire always wants to burn upwards. That's the summer, obviously. Often if we see what we call like fire diseases, we see a lot of manifestations at the top of the body, in the head, in the face, in the tongue, in the throat. Rarely do we see it just in the feet. And if we see it in the feet, it's actually because there might be a deficit of that cooling water and yin. And so there's not a fire, but there's heat coming out to the periphery. It's exploding outwards. It's not shooting upwards. Earth is a very neutral, very basic element, but it tends to get really, really damp, soggy, and wet. So often if someone has too much earth element, they might be overweight or have a lot of sweat, or just have no appetite because everything's kind of bogged down inside of them. Metal has a constricting aspect, so that's the fall. It's kind of, the leaves are falling, energy is returning down to the roots. It has an inward motion. So often if someone has a lot of outward energy, like they're really irritable or something, we might use the metal element to kind of bring that back in, or to maybe not even bring it in, but maybe just counteract that energy in that direction. And then of course, water always wants to go to that lowest place. And so often when we see watery diseases, we might see water swelling in the lower legs, or issues with urination that just comes out, or depression sometimes. Not always is depression a water disease, but we might look at it that way depending on the manifestations. So again, I don't want to get too bogged down in this. It's really complex, but it is really, really helpful. And this chart is the basis of it all. Like, it has so much information there, even though that information seems really simplistic at the same time. All right, now we get to talk about the meridians. These are not by any means the best charts of meridians, but these two charts give you a really good overall view. You can see color-coded different meridians, and we'll talk about what meridians or channels are in a second. I think in this presentation, I mostly call them channels, but meridians, channels, same thing. These are where we find our acupuncture points primarily, not only, but very much primarily. The acupuncture I do, I probably use points on meridians and specific points 95% of the time. Rarely am I going off of them, although you absolutely can. And so every meridian has a different pathway. It has a different organ it's associated with, and it has its own points, and has its own character, just like the organs that we'll see. And in fact, the channels of the meridians essentially are extensions of the organs. They're how our body, in our concept of how our body works, they're how we distribute resources, they're how we interact and spread communication. Of course, there's a nervous system, and that is different and faster, but they're not the same, but there's some interrelation. But it's not only interaction within our body, it's interaction with our body and their environment. So somebody who has a lot of spleen or earth energy, and I'm kind of building it all together, or you could call that a lot of yin in some cases too. That's a very heavy substantive energy. Again, they might be overweight. Their digestion might be poor because everything's really boggy. They might have no thirst at all, even though they need to drink water because they can't imagine, getting more hydration in there because they're not using the water that's already there. So somebody who has a lot of spleen or earth energy might feel worse on a damp day. And actually, sometimes we can palpate that spleen meridian and feel it as puffed up or boggy, or there might be a skin manifestation over that meridian, not necessarily just on that day, but kind of being exacerbated on a damp day because there is this interaction, not just at our skin level, but at this meridian level, which is comes up to the skin, but it also, as meridians travel from our extremities, from our toes, from our fingers inwards, they essentially go deeper and deeper and deeper. Similarly, like we get, bigger and stronger and thicker muscles towards our core, same idea. As I said, they each correspond to a single Zongfu organ, and essentially it's an extension of it. Not everyone likes to think of it this way. I like to think of the meridians as a very beautiful but sort of like tentacle out from the organ, and they can both have that communication, elicit change, and give information to me from that organ and from that whole system. Where's it going with that? Anyways, essentially, it can do a lot of communication through that. And it can also use the meridian, we talk about the interaction with the environment to sequester illness. So often we see illness in the joints or illness on parts of the body. I'm using illness as a very broad term, but like chronic pain, chronic joint dysfunction, we see that as the meridians actually as a protective function, keeping that disease from getting all the way to the organs and causing an organic interior illness. So essentially, it's really helpful to think of meridians as rivers of blood and energy, or substance and energy, and connected and part of each organ. So going back to the flow of the meridians, we see that all the yin meridians, because we look at the body as reaching our hands up to the sky as opposed to our hands down by our side, because then you can see the yang meridians. There's 6 of them, but in a way, I don't want to get too complicated. There's actually only 3 of them because there's yang pairs. So the yang meridians are essentially coming from our hands, from up by the sky, going down to the earth. Yang through us is trying to manifest in the earth, and yin is coming up from the earth, the very yin centered part of our existence, up towards our organs and out towards the sky or where the sun is, And the idea is that the earth being very yin, we're built from the earth. We're built off of the pattern of the earth, and yin is its natural trajectory is up from the earth, and yang is coming down from the sun, essentially. And I don't want to get too new agey about that, but it's very helpful in terms of pattern recognition and thinking about kind of all of this. So I threw this up just for your own information. I know this is small on your computer screen. You can zoom in. I think everyone should have a PDF of all of this, hopefully. And if not, we can get it to you. But I just want to show each organ. Again, there's always a little bit of a language or translation issue. So you'll see down here, they call it the triple energizer, towards the bottom. And they say it's the same thing as the duodenum. It's not, but they're welcome to try to translate it that way. But we can see the pathways of all the meridians and kind of get a sense of, yang meridians tend to be on the outside of the body and on the back and on the head. And yin meridians tend to be on this medial side of the body, our chest, our diaphragm, and inner part of the arms and inner medial part of the legs. With the exception, for some reason, of the stomach meridian, which we can see over here between the 7 and the 9, that does travel very medially. And there are, theories and reasons for that, like why that is. But it's beyond the scope of what we're going to talk about today. That would just be a confusing digression. So again, Yang meridians go top down, essentially. You know, they go over our head and top down, travel on the outside of our body. Yin meridians come up from the earth, up through our feet, and travel up in our body. Just gonna check the time. Oh, good, perfect. So still looking at the channel system. Channel system is used in all external therapies of traditional East Asian medicine. You can say we use it a little bit in herbalism too, although we're not going to get into it, but there is a little bit difference in terms of when we talk about organ theory and channel theory, because of the channels are so external and they interact with the environment. There's a little bit of a difference there, but definitely using all external therapies. So cupping, I definitely look at the channels. When we use moxibustion or mugwort burning, we're almost always doing it over acupuncture points or specific channels, or at least specific regions related to that channel. Even something like the massage, the tuina, or a scraping technique we call gua sha, we're always looking at the channels and trying to figure out where something is stuck and how we can help it. So often we might look at something stuck in the shoulder, figure out where the epicenter of that is, and then go down the arm and say, oh, you know, maybe we can work lower down on that channel, that large intestine channel, to really draw it out and down, or to, you know, send energy back up and affect a change right there. I have someone recently I'm working with who has long-term shoulder pain, a ton of surgeries, and just amazed at what's happening. And all we're using are points on his hand and points on his foot on the opposite side of his body. And he's just like, that can't help my shoulder. There's no way, but it does. And the way that we can think about it and the way that we utilize all of this is through channel theory. And actually, you know, this has always been in the medicine, but there's a lot of kind of rediscovery or new elucidation around channel theory that's really exciting in traditional East Asian medicine right now. So getting into the weeds of channel theory is really just fun for us East Asian medicine nerds. It is important though, even though I keep talking about them as a thing, the channels are not a real thing in that there's no anatomical structure. You know, there's not a blood vessel. It's not your nerves. There's correlations with all of this. Some people talk about fascial planes, but even that, you're talking about a hollow space between two fascial planes. So there's not a thing that we point to. We're talking about function and ways we can look at interaction and data that the body's giving us and information we can put back into the body to help it function and heal, essentially. But there's not a thing there, even though we talk about it and use it as if it is a thing. That being said, the channels can provide like discrete diagnostic data. Like all the time, I'm pressing people's channels, pressing acupuncture points, looking at the skin, looking at swellings, or someone has a really big a cyst, a neuroma on their spleen channel, and we're using that information to help that cyst at least reduce in size and reduce in pressure. All the time I'm touching people's specific channels or like a couple channels at once to kind of figure out, is this channel really hot and this channel is really cold, and that can give me some good information, or something feels really sunken even in like a long line, or there might be accumulations that we can feel as like a rough patch under the skin, or really minute swelling that feels like fog under the skin. And this can all give great information in a discrete line that we know to look at, but there's no structure there. There's nothing there that is providing this. So it's a ton of data in a group that we can look at, but there's nothing to point at and saying that is the thing. And that's kind of a case study of the whole medicine, in that we're looking at function and data that we can use, learn from, and provide a treatment plan from, even though a lot of the things aren't like a real thing. So that can be a hard thing to grasp and a hard thing to run up against. And so similarly, rivers are really, I think, a really excellent metaphor in that, what is a river? A river is a pathway for water, but the river isn't necessarily the water. So if a river is dry, is it no longer a river? Is it just, you could call it the riverbed, sure. Or like the Grand Canyon, ancient rivers, but they're not there anymore. And so we can see the manifestation of these rivers, even though the rivers aren't there. Channels can become boggy, they can be too cold, they can be too hot, so they can be, frozen over, or they can be kind of boiling and steaming. They can be full of junk. They can, and junk is a very technical term, but, it can incorporate blood stasis or dampness or phlegm. It can be empty. It can be way over full. So a river is a river, but then when it floods and it's a floodplain, where's the river? It's still there, but it's not really a discrete thing, because you can kind of infinitely dissect it. And eventually, the concept of the river, but there's no one river there, and the water's always changing. But similarly, to anything that can happen to a river, that can essentially happen to a meridian, more or less, or a channel. And it can be an excellent way to think of it so that you can know what to look for and how to process that data. All right. So now we're just going to briefly touch on diagnosis. I know we're getting, somewhat towards the end, and I want to have a little bit of time for questions. So I'm going to go a little bit faster. Again, this is a theory class. You're not diagnosing people. You're not trying to get your license right now or anything. It's just for information's sake and for interest. So how do we diagnose? I mentioned palpating meridians. Of course, I talk to people a lot. I ask them all about what's going on, how things are processing, how's their digestion, how's their sleep, how everything's going, how their emotions are. Emotions are really important in this medicine. I touch pulse a lot. I say pulses because there's actually a lot of different pulses around the body we can take. Many of us, myself included, almost exclusively take the Sunko pulse, or the pulse on the wrists. As you can see from this diagram, the wrists are each provide different data, and before and after a treatment, the pulses can totally change in strength, in which position is strong or which position is weak. So it seems weird because it's all blood pumped from the heart, and all in the same singular vessel, but we can get a lot of interesting information from it. And tongue, again, a microsystem, a mini map. We can look at and see, oh, you are a little bit dry, but really your stomach is quite dry, or you have a lot of heat and it's all in that, that side liver and gallbladder area, but your heart's doing okay. So that can give us information on what's there and how to treat it, like where to pull it from or where to supplement, where to help. And the tongue can tell us a lot about blood flow, digestion, hydration, yin and yang, which we'll talk about more in a second as like discrete items, heat, cold, pain, even all sorts of different stuff. So it can really be quite illuminating. So very basic but very helpful format for diagnosis is called the 8 principles. And you're just looking at, there's a problem. What's the basis of the problem? Is it internal or is it external? Did it come from outside recently and maybe we can kind of push it off more easily? Or we should treat it through, an external or a pulling or even external application of herbs or something like that? Or is it internal? Pretty basic concept. Is it hot or is it cold? Usually very straightforward. Sometimes there's a big mix. So I'm treating someone right now that they're really cold. They have really cold hands and feet, but the top of their body is all hot and they have like hot red acne and there's heat on their tongue and there's other heat signs, so it's a big mix, and often there's a big mix. So again, that idea of everything being relative is very helpful sometimes and confusing and not helpful sometimes. Deficiency and excess. So, is the problem an issue where there's not enough of something in the body? There's not enough blood. There's not enough qi. There's not enough whatever, or there's not enough blood in this specific location, or there's not enough qi at this time of day, or whatever have you, or qi in the digestion? Or is it excess? Is there something that's stuck and bogging the system down, whatever that is, whether it's something more liquidy and earthy like phlegm or dampness, or whether it's literally just like injury and stuck blood and something we have to kind of unravel. And then yin and yang, again, are broad concepts that incorporate the whole column on each side, all of these things. But they are sort of fundamental substances in the body that, again, are functionally real, but are not physically real. So we can't point to one thing and say, that's your yin, or, take a syringe and draw all the yin out of someone's body. We can't find the yin, we can't find the yang, but we can evaluate them in terms of often heat and cold, excess and deficiency. And going back to yin and yang theory as substances, if yin is in excess, yang is disease. Like yang is getting pushed down and there's not enough of it and it's not balancing that yin. And if yang is in excess, yin is disease. So vice versa. And similarly, if one of them is deficient, but the other one's kind of what would be a normal level, we'll see similar issues, but in a different manifestation. So for example, someone with excess yang might be hot and have high blood pressure and have big headaches, what have you. But somebody that has deficient yin, so the relative excess of yang is there, but even though their yang should be at a normal level, just the yin is low, they might have very different systems in terms of not sleeping well, or heat that's like just in their hands and their chest and their feet, or a lot of like strange dryness issues, but also issues of essentially accepting more of that hydrating yin. So it's more an issue of the yin being diseased, even though the yang is showing the symptoms, if that makes sense, hopefully a little bit. We're almost to the end. Treatment, as I mentioned, there's all these different modalities, all these different tools, all these different lenses we can look at to figure out what our treatment plan is going to be. I just want to mention a couple things about treatment, because this medicine is all about cycles and circles and everything being in relation. So again, you have to see the whole circle before you can really understand parts of it usually. So of course, treatment can involve one or many different modalities in the tool belt. It can be a treatment with all of them or just one, no problem. But treatment is always diagnostic, meaning what happens during the treatment, what happens after the treatment, what happens the 2 weeks after the treatment, all lets us know how the treatment affected someone. And because everyone is these, very dynamic systems where a lot of different factors are going on all the time, we get new information from the diagnostics of treatment. So a really easy example is like with cupping, fire cupping, which is a suction technique. It marks up the skin. And if you're doing the exact same strength of cupping on two different people, they'll mark up very differently, not just because they have different skin types and skin thicknesses and all of that, which is, data that can help you, but it can tell us how bad, how much heat they have right there if we're treating a heat disease, or how bad the stuck blood is if we're treating an injury. So someone that has a really, really bad old injury, when we do that cupping, they're going to mark up really purple, even almost black sometimes. And it can be quite alarming to them if, you don't tell them that it might happen before. Even though it might feel way better really soon afterwards, it can look really kind of gnarly. But that treatment brings out information that we're then using to bring into our understanding of where this person is, where the forces are for them, and not only what we might have missed, or uncovering things that were overlapped with other issues or more prevalent symptoms or manifestations, but also can help us understand where they're going with the treatment, and what we might need to do to course correct next time. Even though that treatment could have been just what they needed, the next time that might not be the treatment they need. And in my practice all the time, I might do the very same treatment on the same person twice in a 2-week period, and then I'll leave it alone for a little bit because, if I'm giving someone a very specific push in one direction, eventually I'm going to unbalance them because I'm pushing them too much in that direction, and we need to course correct with something else, if that's necessary, or maybe they're feeling a lot better and that's enough treatment and they should just, try to live a healthy life as best they can, and stay healthy. So again, it's that circle of, understanding and diagnosis and treatment and getting more understanding and revisiting your diagnosis and your understanding of where someone is, because it's all about presence and the present moment of where someone's at, not necessarily at all the story of their disease. And I just want to include some further reading. The Web That Has No Weaver is excellent. It's not for a student of Chinese medicine, it's just for the average reader, but it has tons of depth to it. And it talks a lot about the difference of basic understanding of how the world works and how our medicine works and how our bodies work between the a Western mindset and that Eastern mindset on a very basic level, even, much more fundamental than I was talking about today. I still occasionally read chapters of this book because it kind of helps reset my thinking and revisit things that I'm forgetting or missing. And then I included this, The Foundations of Chinese Medicine. This is actually a textbook for students of Chinese medicine or East Asian medicine. And of course, these are both calling it Chinese medicine, which is fine. I don't necessarily recommend you get this, but it does have a lot of really good explanations, really basic step-by-step walkthroughs and building on concepts. So if you find this fascinating and not too bewildering, definitely The Web That Has No Weaver is great, and The Foundations of Chinese Medicine can be quite excellent if you really want to dive deeper and take your time. And I think that's it for us. So thank you, everyone, for your attention and your time. I know that's a flood of information. I hope it was semi-intelligible. I think we have just a little less than 10 minutes left, but I'm happy to stay here for a few minutes. And if anyone has any questions, or anything even that I didn't talk about, I'm happy to spend this time with you.
Feel free to put those in the chat or unmute yourself and ask a question if you have one. You're also welcome to take off if you don't want to stay for question and answer.
I have a question.
Yeah, please.
So do people usually come to you with a specific whatever complaint, this hurts, I don't like this, whatever, or do people sometimes come just for an overall, like a physical, to see if there's something that you can help them feel better?
Both. Usually the former, usually a specific issue. I mean, it's as somewhat invasive medicine, I use a lot of herbs, but I primarily do acupuncture. Like there's a rare case where I'm using herbs and no acupuncture, although that does happen. So usually just because of the process and the cost and everything, people have things that they want fixed. Specific. So yeah, specific items. That being said, I do see a lot of return patients who are doing really well, just, maybe coming for a tune-up, they often call it, just to kind of, things build up over the course of the year, the change of seasons, our habits that aren't perfect. And so just kind of trying to pick that apart before it manifests as disease or anything even uncomfortable. Okay, so both, but primarily with myself, the former.
Okay, thank you.
Yeah.
That was the exact same question I was going to ask, Rando. I want to go in and get, okay, we need to do this, and then you're going to feel wonderful.
Well, that's always the hope. Sometimes this is rare, but sometimes we can ignore an issue that's going on. And then let's say you have some issue that is, you don't even really think about it anymore. You come in and, things are going well. So I see exactly that issue and I start treating it. Sometimes, especially a good example is emotions. Emotions are so important in this medicine. And so sometimes someone will have really strong emotions around something or long lasting emotions that they can't really clear. It will create an issue in their body. And then when we start treating it, essentially we're trying to unravel that issue and not physically, of course, bring the emotions out, but I always say you feel them when they come in and you feel them when they come out. So sometimes if there's a problem that is ignorable, but we start treating it, it can manifest more immediately because it's kind of unraveling and you feel it on its way out. But then hopefully the idea is then it's gone. So I only mention that because, you know, it's rare, but there are cases where someone comes in and goes, well, I don't feel very well after that. And I tell them to check in with me in a couple of days. And usually things have really cleared and they feel a lot better. But, you know, we can call that sometimes like a healing crisis, although I don't love that term. And it's important to recognize that that can happen.
Okay, any other questions? I don't see anything in the chat. So, well, I appreciate, oh, one more, go ahead.
I'll take another quick one. I'm just curious. So does insurance cover services, or is it mostly you just pay? Asking for a friend. No, I'm just curious.
No, it's fine. That's a totally valid question. I mean, this is all part of it too. So sometimes insurance will cover it. It's a plan by plan case.
Okay. Like everything else.
Yeah. Like everything else. I don't take insurance because I'm a one-man operation right now. So I don't process insurance. I can help people try to get recouped from insurance, but I just always want to be upfront with everyone that they're paying me for a treatment, and then hopefully we can get that reimbursed. But you know, and different insurances that I've had experience with, and at my previous practice, we did take insurance. Some of them are easy as pie once you clear the initial hoops, and some of them will have you chasing your tail for a year to ultimately just say tough luck.
Yeah. No. Okay. I was just curious. So
sure.
Thanks.
Yeah.
It's a great opportunity if someone has a HSA to be able to use that for acupuncture, because that's a covered service under that.
So smooth. HSA is just like using a credit card. So easy.
Yeah, that's great. Yeah. Okay. Well, if there are no more burning questions, then I would just like to thank everyone for joining us tonight. And thank you, Charles, for your lovely presentation. It's always a pleasure to have you.
Charles.
Yeah, thank you guys for sticking around with me just talking your ear off for so long. And I didn't do the very last thing. It just my contact info, my email. It's my clinic name, Artemisia Acupuncture Clinic @gmail.com. Any questions, any follow-ups, oh, I wish I had asked him this, just send me an email. I'm always happy to chat about this stuff.